My name is Dr Dawn, I'm an NHS GP and I also work on Channel 4's Embarrassing Bodies and on ITV's This Morning. I am still very much a practising NHS GP and I remember very clearly the first patient I met with sepsis. We're talking about 20 years ago and I see thousands of patients a year. It was a young child who was rushed into casualty. He had been completely well the day before. In fact, he'd been well that morning and he'd become very sick very, very quickly. He was limp, he was floppy, he had a dreadful rash, and that poor little boy didn't make it. We worked all night and he didn't make it. You would think that's a rare story. He is one of 37,000 people who will lose their lives to sepsis this year in the UK alone. And for everyone who doesn't survive, there are probably 2 more who survive, many of whom with quite significant disability. So by sepsis, effectively we mean blood poisoning. I think that's what most lay people would appreciate, would understand. And people who are totally healthy can become catastrophically ill very quickly. So my involvement with Sepsis UK really is about banging the drum and making sure that people know. And as a mum particularly, you know, if you're not happy with your child, if you think somebody that you love and care for just isn't right, you need to seek medical help. And only by making a lot of noise, and I hope we are going to make an awful lot of noise, are we going to raise awareness of the condition. And by raising awareness of the condition, hopefully people will present sooner, and that tragic 37,000 number is going to fall. It can be very difficult for the lay person to know, when do you call the doctor, when do you call 999? And I think unfortunately we do spend a lot of time as well saying actually the NHS is under huge strain, and it is, and we don't want everyone with a cough and a cold raging through our door saying, have I got sepsis? Because if you've got a cough or a cold, you might be a bit feverish, you might be a bit off colour, you may not want to eat very much, but you don't feel toxically unwell. And it's the person with a very high fever who just isn't behaving properly. They may be limp, they may be floppy, they may be slightly delirious. That must not be ignored. That's a medical emergency. Actually, that's not even your GP. That is 999. Get yourself into casualty and get the appropriate antibiotics. The amazing thing, if there can be an amazing thing about such a dreadful condition, is that actually if it's caught early and we can get the antibiotics in, often into the vein directly, then actually we can completely change the outlook for those people. I think there are a lot of conditions that have got much higher profile today, and that's a really good thing. So there is probably nothing that gets a woman through my consulting room door quicker than a lump in her breast. Everybody knows, could that be breast cancer? In fact, 9 out of 10 lumps that get as far as seeing a specialist turn out to be benign. The problem is I think the public don't fully understand what is sepsis. They don't question it. They don't worry enough, maybe. Now, I don't want to be a scaremonger, and obviously most people with a fever are going to be absolutely fine. They've got a minor self-limiting illness. But it's those really hardcore signs that we need to make sure that people are aware of and that they question. You know, could this be sepsis? Because the earlier we treat, the better the outlook. And don't forget, actually, sepsis kills more people in the UK than breast, bowel and prostate cancer all put together. Now, if I went out in the street right now and I asked the first 100 people to tell me the signs of breast, prostate or bowel cancer, I would get a pretty good story. Most people would know what to look out for. Unfortunately, that's what we've now got to do with sepsis. I think the UK Sepsis Trust is a tiny charity and they don't have a lot of money. But the amazing thing about this actually is we're not talking about very expensive drugs. We're not talking about high technology. If the signs are missed, of course we are. We're talking about people being in intensive care and costing the NHS an awful lot of money, and actually potentially when they survive costing yet more because maybe their kidneys fail, their liver fails, maybe they lose a limb. We're talking about a really serious illness. UK Sepsis Trust can actually make a huge difference with a relatively small amount of money. So the fact that they're small in some ways is quite good because there's not a huge amount of administration work. So the money that people donate goes to the charity and goes where it really needs to be.